is a time for us to act, all of us together. We all must do more. We must honor those we have lost by doing everything we can to prevent as many deaths as possible. Today, we're at a new stage in fighting this pandemic, facing an evolving set of challenges. We have to double down on our efforts to get shots in people's arms, country by country, community by community. Ensure we have reliable and predictable supplies of vaccines and boosters for everyone, everywhere. Expand access globally to tests and treatments. And we have to prevent complacency. This summit is an opportunity to renew our efforts, to keep our foot on the gas when it comes to getting this pandemic under control and preventing future health crises. Collectively, we're making significant new commitments to help keep up the fight against COVID-19 in 2022, protect the most vulnerable populations, and prepare for the next health crisis, because there will be others. You know, and the United States is going to continue to do our part. Today, I'm announcing the United States will share critical COVID-19 technologies through the World Health Organization COVID-19 Technology Access Pool. We're making available health technologies that are owned by the United States government, including stabilized spike protein that is used in many COVID-19 vaccines. We're standing up a new pilot program, working with the Global Fund to expand access to rapid testing and antiviral treatments for people in harder to reach areas. And we're increasing our support for a new pandemic preparedness and global health security fund that will be established at the World Bank this summer with $450 million in seed funding. I particularly want to commend Indonesia and Italy for their leadership in helping make this fund a reality. And I'm encouraging other leaders to join me in upping their commitments. You know, we're going to face together global health crises. This is not the last one we've had. It's not a question of if, it's a question of when. So we have to invest now. We have to secure political commitments now. We have to start working to prevent the next variant and the next pandemic now. And that's going to require all of us to do more. I encourage every leader to ask yourself, what more can I do? How can we work more closely together to help more people? How can we save more lives? That's why I continue to call on Congress here at home to take the urgent action to provide emergency COVID-19 funding that is vital to protect Americans, to make sure that we maintain our supplies of COVID-19 tests, treatments, and vaccines, including next-generation vaccines that are being developed. The request also includes $5 billion to keep up our global partnership in the fight against COVID-19 and sustain our efforts to get shots in people's arms all around the world, expand access to treatment, and save lives everywhere. We can do this. We can control COVID-19. We can start to build a better, healthier, and more secure future today if we all do our part and if we step up together. So thank you for responding to this fight, and most especially, thank you for all the doctors, nurses, and community health workers, and scientists, and aid workers, and anyone and everyone on the front lines fighting this pandemic, saving lives every single day. We owe you. Thank you. God bless you all.
Thank you to President Biden, Vice President Harris, our distinguished co-hosts, partners, world leaders, and everyone tuning in today. Together, our efforts will help end this pandemic, which has caused so much pain and disruption. My name is Linda Thomas Greenfield, and I have the honor of representing the United States at the United Nations. When we convened the last summit, I said that only a truly global response can meet this moment. That was just over 7 months ago. And in that time, our global efforts have saved countless lives. The United States, in partnership with COVAX and others, hit a critical milestone, donating over 500 million vaccine doses to over 115 countries. We've provided more than $19 billion in COVID assistance, ranging from health, humanitarian, economic, and development support. But we know supplying COVID-19 vaccine isn't enough. We also need to accelerate vaccine uptake and ensure vaccines make it into arms quickly and equitably. That means tackling difficult cold chain supply issues, addressing vaccine hesitancy, and expanding distribution support. And that's why we launched the Global Vax program to further ramp up COVID-19 vaccinations around the world, providing resources to more than 70 countries and surging support to 11 developing countries in sub-Saharan Africa to reduce vaccination barriers. I've had the opportunity to travel around the world, from Niger to Thailand, and I've watched the vaccines we've donated actually go into arms. I've seen how our assistance has protected vulnerable populations and frontline workers from sickness and death. But our work isn't done. In total, we'll ship out 1.2 billion doses across the globe with no strings attached. We're doing this because no country can end COVID alone, and we're committed to increasing vaccination rates for every country. Today is about keeping up the momentum and saving lives. As the disease continues to evolve and new strains emerge, our strategy to defeat the pandemic must also evolve. Let's marshal our collective knowledge and resources to distribute more vaccines, expand equitable access to testing and treatment, and support healthcare workers. At the same time, let's also keep our eye to the future so we are better prepared to prevent and respond to the next pandemic. The investments we make today to strengthen our health systems, protect those in need, and make access to vital resources more equitable will pay dividends for years to come. And that's why we're focused on advancing global health at the United Nations, where I'm working with coalitions on antimicrobial resistance, global health, security, and universal health coverage. We have to come together bilaterally and multilaterally to ensure our global health system is as strong and prepared as it can be. And now I'm pleased to introduce President Macky Sall, African Union Chair and one of the co-hosts of today's summit. Senegal's COVID-19 response and recovery efforts through a go early, go hard, and keep it simple approach is an example to all of us. Mr. President, over to you.
Thank you, dear Linda.
Thank you very much, dear colleagues, ladies and gentlemen. I would like to acknowledge and thank President Joe Biden for his invitation to this second COVID-19 pandemic summit. I salute our fellow co-organizers, President Widodo, Chancellor Scholz, and Prime Minister Briceño. I also salute the presence of the heads of state and government, and in spite of the improving situation, the holding of this summit shows that we must not let our guard down and that we must be prepared for other potential health challenges. In Africa, we have been able to remain resilient in the face of COVID-19, with relatively few positive cases and deaths compared to the rest of the world, whereas the worst was feared. Our countries have adopted response strategies, each within their means. We have also coordinated our response efforts at the continental level under the leadership of President Cyril Ramaphosa of South Africa, with the support of the African Union Commission and Africa CDC. I thank the partners for the donations of vaccines through the COVAX, AVAT, and bilateral cooperative initiatives.